Ma'am, good morning, ma'am. No. Good morning, ma'am. Why? Good morning, ma'am.
Good morning.
Ma'am,
Good morning.
we will start within 10 minutes, ma'am. We are waiting for the students to join, ma'am.
Yes, yes. The guest has joined.
Ma'am?
No, the guest
Has
has
joined, ma'am.
just.
Yes, ma'am. Dr. Ma'am is joined, ma'am.
Okay.
It's a students' break time, ma'am. So we're waiting for them to join, ma'am.
Okay. No issues. For what? Anything for 1 hour.
Life is not about who you were once. It is about who you are right now and the person you have potential to be. By Nishan Panwar. A very good morning, everyone. This is Vigneshwari again with you all for the final day of series of health webinar Arogya Vidya, a pathway to well-being, organized by Srimati Devkundwa Nanalal Bhatt Vaishnav College for Women, along with our health partner, Apollo Science Foundation. 4 things let's us ever keep in mind. God hears our prayer. God heeds our prayer. God answers our prayer and God delivers by prayer. We start our program with our prayer song.
सत्यव्रतम् सत्यपरम् त्रिसत्यम् सत्यस्य योनिम् निहितम् च सत्ये सत्यस्य सत्यम् हृतसत्यनेत्रम् सत्यात्मकम् त्वाम् शरणम् प्रपन्नाः कर्तायाम् हस्तौ च कर्मसु मनस्तव पादयोनः स्मृत्यां शिरस्तव निवास जगत्प्रणामे दृष्टि सदा दर्शनेषु भवत्तनूना नमो भगवते तस्मै कृष्णायाद्भुतकर्मणे रूपनाम विभेदेन जगत्क्रीडति यो यतः ॐ शान्ति शान्ति शान्तिः.
A leader is the one who knows the way, goes the way, and shows the way. Now, I call upon our Vice Principal, Madam Dr. Mahishasura Mardini, Self-Support Team, to welcome the gathering.
Good morning to one and all present here. I feel extremely privileged and honored to be given this opportunity to welcome you all for the series of health webinar. I place a record of appreciation to Mrs. Mahalakshmi for organizing the series of health webinar in association with Apollo Shine Foundation. On behalf of the management, principal, and the faculty members of SCMB Vaishnav College, I extend a warm welcome to our chief guest, Dr. Anita Tharigopula, Pediatrics. I also welcome our student participants and other program organizers to the webinar. Welcome.
Thank you, ma'am. Thank you for your encouraging words. Now I call upon Mrs. R. Nitya, Assistant Professor, Department of BCA, for event review.
Good morning to everyone. Arogya Vidya is a series of webinars conducted for 5 days, starting from 7th March, which emphasized importance of health under various topics. The speakers are Day 1, Dr. Indra Jaikumar on the topic Debunking the COVID-19. Day 2, by Dr. Saubarnika Ramamurthy on the topic Healthful Living for Young Women. Day 3, Dr. Daphne DK on the topic Mindful Eating. Day 4, Dr. Kirti Pai on the topic De-stress now, ask me how. And day 5, that is today, by Dr. Anita Tharigopula on the topic Basics of Giving First Aid. The event aims on making awareness and acknowledge about physical and mental health in current scenario, especially for women. I think the session would be informative to all. Thank you.
Thank you, ma'am. First aid is the first and immediate assistance given to any person suffering from either a minor or serious illness or injury with care provided to preserve life, prevent the condition from worsening, or to promote recovery. It includes initial interventions such as performing CPR while waiting for an ambulance, as well as a complete treatment of minor conditions such as applying a plaster to a cut. There are many interventions and aids which can be given under emergency. There is more than it meets the eye. To know more about how to give first aid to people under emergency, we have our esteemed chief guest, Dr. Anita Tharigopula, DNB, consultant in Department of Pediatric Emergency and Trauma. Participants can post their queries in the chat box as there will be answered at the end of the session. Now, I call Sneha to brief about our chief guest of the day.
I welcome everyone for today's webinar on basics of giving a first aid sound by Dr. Anita Tharigopula, DNB Pediatrics, FTEM, STEM Fellowship, PPT Emergency and Trauma, Postgraduate Diploma in Medical Law and Business Science. Dr. Anita Nath is a renowned consultant in the Department of Pediatric Emergency and Trauma. She is also an instructor in patient advice and medicine service, basic life support, advanced trauma life support, advanced human life support, and an executive board member, IAP, ASK, Adolescent Health Academy, MI. Her key interests value for the children.
And Dr. Anita here. Am I really audible?
Yes, ma'am, you are, ma'am.
Yes, ma'am.
Okay, and somehow I'm not able to share the screen on Zoom. Just wanted any particular reason that is happening?
Ma'am,
Yes.
ma'am, this is Mahalakshmi here.
Yes, Jay.
Ma'am, can you
anybody
send the
able to
PPT to me so that I can ask my students to share it, ma'am?
Okay, I'll do that right away. Can you give me your mail ID,
Yeah, ma'am.
please?
Ma'am, just WhatsApp me, ma'am.
I'll do that. I'll do that. Just
Yeah,
give me
ma'am.
a few minutes.
Thank you. Yeah, ma'am.
Am I audible right now? Yes. Am I
Yes,
audible
ma'am, I
right now?
received it, ma'am. Within 2 minutes, we'll present the PPT, ma'am.
I think you'll be able to see my screen right now. Are people able to see my screen?
No, ma'am.
Not yet. Okay, fine. If you could then share the screen, that would be great.
Okay, ma'am. Yes, ma'am.
Okay, super. Am I audible right now?
Yes, ma'am.
Yeah, super. So sorry for the delay. Actually, I think I'm not that gadget friendly, which says that we are the old generation. I really apologize for taking away your time. I was actually asked yesterday if I need to share the presentation. I thought I'll be able to do. Somehow this always happens whenever I'm about to talk, something happens to my computer and my phone. I did keep up with the updated version of Zoom, I guess. Good morning to one and all, and I'm Dr. Anita. I work here in the Pediatric Emergency Department, which is quite close to my heart. And more than just emergencies, adolescents and kids are what we love the most, and that's why I am a pediatrician. What we are going to see, I know it's quite a big slides, 83 slides, but trust me, we're going to rush. We're going to make it more interesting. I want all of you to talk whenever required. Let's make it more interesting by talking to each other. So it's not a lecture, it's just a discussion. So what we're going to concentrate today is only on first aid and how to go forward regarding this particular thing. So when I say first aid, what is it that comes to the heart? It's something, the aid that reaches you the first, and also what can be done to the person or the victim the moment we reach to them and before advanced services come into play. So if I can have the next slide. Next slide, please. Yes. What we're going to discuss is have an introduction and essentials of what is going to happen. We're going to deal what to do when anybody is bleeding, somebody has sustained burns, how do we handle minor injuries, what do we treat with medical emergencies that we need to attend immediately even before we arrive to a hospital. Some poisonings, let's say stings, bites, or even injections of chemicals or unknown material, what can we do as a lay person out there? And also we'll see if a person, if our colleague, anyone out there is seizing, what do we do? If somebody is having a heart attack, what do we do? And how do we call and reach out is the main thing that we're going to look forward to. With that, we'll be moving to the next slide where we are going to, next slide please. Yeah. So the whole purpose is what to do in an emergency when we have a little or absolutely no medical training. So what are the first aid procedures? That is what we're going to look at. Next slide, please. Okay, I'll be happy if you can go to the next slide. So the way to know what is happening inside is actually becoming an insider. So I'll try to be a student back again, which is one of my favorite times back. And Chennai has been my favorite place out there. So this is a Tirukkural which says, mentioning the same thing, that the way to do a thing is get inside an insider. So with that, we'll move on to the next slide. We are going to look at the ABCs of the essentials that are true to the emergency situations, whether in the hospital or away from the hospital. So what are the plans for the persons with special needs is what we are seeing in the next slide. We are going to look at risk medical conditions like seizures. A person is having sugar issues. Next slide, please. Sugar issues, life-threatening or severe allergic reactions. They're having some breathing difficulties, or they're already known asthmatics. They have some, like, we can be addicted. So what is technology addiction? How medically fragile are we? So the challenges that we are facing can be of all this. We may or may not look into this, but difficulty walking up or down the stairs, all of us do face at one stage of life when we have minor injuries or major injuries. Moving on to the next slide. This is what I've learned growing up as an emergency physician. The only way I can treat, what makes us a little different from the parents who bring in their kids or parents of adolescents, is simple. We need to be calm ourselves so that our brain thinks good for treating others. So that applies to every stage of life, every individual, any profession. So we need to remain calm. We need to anticipate that injuries can happen in the college grounds too. We need to be prepared. At the same time, we need to prioritize injuries. Suppose something happened, all of a sudden there's rain and somebody has fallen down, slid down the balcony, and it can injure multiple people. So whose injuries are to be treated first? It's not first come, first serve. It's always the most injured is treated the first. And yes, I have been taught first aid, so am I able to manage everything? But to what extent? When do I call an emergency medical service or an ambulance? When do I make decisions? When can I do things? Given the pandemic situation right now, we all need to use universal precautions. No doubt about that. We used to do pre-COVID, take a separate session. I know even like toddlers are better at doing hand hygiene than most of our doctors itself. So the only victim and injuries have been evaluated. You need to move the person away from the site of injury if the scene is unsafe, and also it is safe to do so. Who do we report? Do we need to report to just the administration? The administration won't involve the parents, guardians. That is individualized according to the institute. An EMS physician, do we have time to go to the ambulance, hospital, or do we need to bring an ambulance here? How do we make these records available for everybody? So universal precautions, why do we need it? Moving on to the next slide, that is what it talks about. Blood and body fluids of every person, they are considered to be quite infectious. Next slide, please. So what we need to do is not just a hand hygiene. What I need to do is also wear gloves. Whether I need sterile gloves or I need regular gloves, I need to know that. How do I dispose the trash? It's just not the trash, it could be even bandages. How do I dispose them? All the more important is I need to disinfect my college campus. How do I do that? Not only first aid only, and every place. Next slide, please. So every place actually is supposed to have something known as a first aid kit. I think from school days we've been learning. I remember we used to have a class called SUPW in my school days, which was some useful productive work. I don't know if you really did something useful in that or not, but first aid kit always had an instruction booklet, which means it has the contents of the minor injuries, their algorithms, because not everyone can remember everything. You need to have for hand hygiene and protection soap or a sterilium. You need to have gloves. You need to have bags to dispose of things, roller bandages, gauzes, tapes, adhesive tapes like bandages, assorted gauze pads, crepe bandages. You need to always have a thermometer in that. If I have eye injury where I'm doing something and there is a chemical splash in the eye, do I have eye wash, saline ampules? And rather, I'll say saline bags, the 100 ml pouches. This is the sterile eye pads that we carry around. Scissors, tweezers. Why do we need tweezers? Not to plug the eyebrows, but there is a reason why we need to have tweezers. I will come in one of the discussions there. Safety pins, paper cups, small flashlights or small torches. They're also known as pen torches. Absorbent cottons, antiseptic creams, betadine, mupirocin, T-back ointments, whichever is easily and available and you're able to store that, you need to have that. And there should be a resuscitation mask in case somebody collapses. So now this was a short gist of what should be there in a first aid kit. We'll see if this all things are going to be used as our presentation goes forward. Going on to the next slide, I'm going to put the question forward to all of you. Next slide, please. I'm going to ask you, when we deal with a person or a victim, one of our colleagues or teachers or anyone working around with us has sustained bleeding, a minor bleeding, a scratch which is bleeding, or some bite which is bleeding, what do you think you are supposed to do? Any one of you wants to come forward and tell me?
They wash the wound, ma'am.
Super. Wash the wound. What else?
And clean that area, ma'am.
Super.
Apply the pressure.
Very good. So, absolutely correct. So, in a methodical order, we need to do first, we need to wash our hands, apply direct pressure. Can I apply it with my bare hands? No. You remember in our first aid kit, we had some bandages, gauze bandages, that we need to put and apply pressure. We basically need one barrier for it, but don't use as much as possible, do not use your own unsterile dupattas or anything because they're not sterile. They can cause infection by themselves. But if there's no other choice, use that and immediately go to the first aid room and wash it properly and apply pressure with a bandage. What you need to do is, if I leave for the gravity to act, the blood will keep flowing. So I need to bring my part up. So if I'm injured in the hand or the wrist, I need to pull it up and make sure it is above the heart level. The only time when I'll be cautious of doing this is when there's a fracture, because any movement can cause injuries to the blood vessels and may cause further damage. If after applying the gauze, I'm seeing that the wound is getting, the gauze is getting soaked with the blood, don't remove that. What you need to do is apply one more dressing over the original part without removing it. Look for features that can be suggestive of blood loss. When I lose a lot of volume from the body, I may feel giddy, I may have a headache, I may start sweating, my heart rate may go up. So these are all features that are applying towards a serious injury. So that is when you need to go to the emergency medical services soon. So as I said, rather than putting the medical terminology shock, what I would say is these are symptoms of extreme loss of volume from the body, either in the form of your blood or vomiting, or even when you have loose stool. You'll feel very anxious, you'll have headache, you might have lightheadedness, you may feel as if you're feeling giddy and falling down, you'll be sweating a lot, you would have turned cold, and you may start blabbering something. So what do I do in such cases? That doesn't mean the person is to be left alone. So the person who's by the side, if I recognize these things, what I need to make the student or the victim lie down, elevate the legs of the person, and continue applying pressure to the bleed and call the EMS. Notify according to your protocol. Uh, yeah, we can go to the next slide. So what I'm going to, Snema, if I can ask you, just follow and keep moving, no problem in that. It can be 1 or 2 slides here and there, don't worry. If I have a nosebleed, this is a question I'm asking of putting forth to everyone. All of us would have had nosebleed at one stage or the other. What should we do then? What do you think should be our approach? So when we have a nosebleed, what we do is we'll make the students sit down, lean forward. What most of the people teach us is make them lean backward. But what we need to do is make them sit down, lean forward, apply pressure. Take a gauze piece from your first aid kit, apply pressure to the lower portion of the nose, and don't keep removing it every 30 seconds to see if the bleed has stopped or not. What you need to do is continue applying pressure for at least 5 minutes. And ask them, don't breathe through the nose. Obviously, when you're applying pressure, it will be difficult for them to breathe through the nose. So what we need to do is tell them beforehand, I'm going to apply pressure. Please breathe through the mouth. And also advise that they should not be, once the bleeding stops, you remove the gauze. Please tell them not to sneeze, not to nose blow, and not to get into physical activity for the next 1 hour. If you see at any point the nosebleed is beyond 8 to 10 minutes, please notify your college authorities and also the guardians out there, because that needs some medical attention after that. This is more important, especially because nosebleeds are quite common in Chennai, especially when it goes dry and hot in summers, which we are awaiting now. Now, how do we deal with burns? Can anybody tell me if I have an electric shock, what would I do? If I have a burn because of some fall of heat over me, what do I do? Hot object. Can anybody tell me?
May I, ma'am?
Yes, please do.
Ma'am, we can use antibiotics, ma'am.
Okay.
And maybe sterile dressing.
Okay.
That's it, I guess, ma'am.
Super. So when I talk about burns, there can be different types of burns. What 2 types of burns? It can be chemical burns or electrical burns. What I need to do initially is simple. I need to understand what is the depth of burn. Is it a 1st degree burn? Is it a 2nd degree burn or a 3rd degree? So 1st degree burns, they'll be just when it falls, something falls over the hand or something over the skin, it becomes very hot. It's hot. So what happens? It turns immediately red. There is extreme pain because the pain fibers are still active here. What happens to the 2nd degree burns is they may be the skin would have got detached. There will be swelling of the mucosa around, and it will still be painful. So beyond the point, if it goes to deeper things, what happens is there will be a yeah, you could go to the next slide, Sneha. Yeah. So if it's a 3rd degree burn, what happens is the whole depth is involved, which destroys your nerve fibers too. So it becomes painless. That doesn't mean they didn't have burns. It means it's gone to an extent where even the pain fibers are lost. So what I need to do is, in a 1st degree burn, it's easy. You're supposed to wash at least 5 to 20 minutes under the water. Please apply a dressing which is not sticking one, which has to be petroleum containing gauze or an aluminum surfacing. Use topical antibiotics like T-back, betadine ointment, or whatever is available. Put a sterile dressing. We don't want infection to happen there. Put a sterile dressing. Elevate the limb. Wherever there's a swelling, please elevate it. Check with your doctor if you need a TT prophylaxis. Always make sure in first degree and second degree burns are very, very painful. Give a paracetamol immediately. That's one of the safest medicines to give until and unless a person is allergic to it. So always ask for allergy history. So this is what you do as a first aid to them. Wash, apply dressing, which is petroleum-based gauze, with a antiseptic solution over the burns, and elevate the limb, check for TT prophylaxis, and also give oral medications. If it is a second degree burn, please contact the doctors immediately. So when we continue discussing about this is the regular burns like hot water. What we discussed is hot water falling or hot milk falling, hot coffee falling, extreme burn. Now, what do I do when I see for electrical burns, which can happen in any institute in spite of the best facilities, because these are beyond our checklist also sometimes. Make sure our tendency is to go and grab the victim immediately. Please don't do that. You will also, because the human body can transmit electricity, you will also end up having electrical conduction. So what you need to do is take a non-conductive material like a stick, wooden stick, which is dry, which is not wet basically. Before that, you need to turn the power button off, assess the victim, and also call for help. And if you are unable to find the power source, at least use a wooden stick to separate the person from the power source. Call for help in any case. I mean, the main button should be off. Then when I'm doing some lab work, or some acid has fallen over me, or some chemical, which could be even a bathroom cleaner, for floor cleaner, which are all acid and alkalis, mostly acidic in nature. How do I do? The thing is, remove the chemical first. Remove the person from the victim, from the source. Main thing is, you have to remove the clothes and wash the individual fully and call for help immediately. This is a basic first aid that we are discussing. Going on to the next slide, I'm going to talk about injuries. Injuries are something which happen, which are unintended, unintentional in nature. So here I'm going to discuss in the next slide. I'm going to show all of you something. What do you think this slide is depicting? Do you think, just look at this and tell me if it is an accident, and if yes, why do you say so? Is this an accident?
Kind of, ma'am, as she's going to jump into the sand, ma'am, but that may not cause any damage to her. I guess so, ma'am.
I totally agree. This is something like she's, as you said, she is about to jump. But this is not that she is committing suicide, she wants to jump there. It is totally unexpected, unintentional. So it is something, accident is always something that happens unexpectedly in an unintentional situation, which can lead to damage. As I said, nothing can happen. There are things that can happen. She can get abrasions, she can get scratches, she can fall down. So this is a school student picture, but the same thing applies in college when you play volleyball, throw ball, basketball, everything, all activities, whether it's kabaddi, cricket, whatever it is being played, this can happen. And we have had situations where we have had severe injuries also. So going on to the next slide, I'm going to ask you, is there any way to prevent this particular thing from happening? So when I say, going on to the next slide, let me tell you one thing. When I say accidents, they are unpredictable, unintentional. Injuries are preventable and predictable. So in that situation, can I prevent the child from falling? Yes, I can do so by giving a cushion to the floor so that she doesn't have an injury, because I know if she jumps, she can have abrasions. But can I tell whether she'll be jumping or not? No, I don't know. Whether she'll lose her balance or not? No, I don't know. But I need to be prepared. So prevention is better than cure, as they say. Why do you think adolescents are vulnerable to injury? It's not exactly the same as is given, because they're still, I want you to move to the next slide, because adolescents still want to explore the environment, especially college students. They are so um, wanting to do things that they may not understand what is the repercussions of their activity, because the adrenaline rush is quite high. They are fearless. That's why we see so many road traffic accidents happening, so many fall from heights happening in adolescent age groups, college students, because they are fearless. But that's actually wrong. They cannot sometimes judge the speed and direction of sound. Going on to the next slide, I'm going to I'm going to tell you the triangle, how it acts. An injury happens when there's an individual, a child, adolescent, or an old lady, and there's also an agent, let's say a chemical cleaner, and there's also an environment for doing so. It's in an open space, accessible. That's how this triangle works out. Next, when I come across cuts and abrasions, there's no bleed. I'm going to assess. What I need to do is clean it under the tap water for 5 to 20 minutes, depending on the size of the abrasion and cut, and I can wash it with soap and water. I need to clean it nicely. I need to apply an antiseptic solution, apply dressing if it is bleeding. I need to write down what was the severity. Now that the mobile gadgets out there, even what we expect is somebody take a photo of the injury and keep it, so that we don't keep opening and closing the wounds frequently, which is otherwise a source of infection. So Sneha has moved on to the next slide, which talks about splinters, thorns, and all which can get stuck, or even your wood. I mean, we're all quite any table's edge can have a wood piece coming out, a splinter coming out. What do you do if it goes inside? As is quite well projected here, we are going to remove it only if it is easy to do so. Do not try to explore it by using a safety pin, trying to open it and see. Please don't do that. Apply a bandage, and if it is deeply inside, you need to notify the parent or the guardian so that the person is taken to a correct center and removed, because it has to be done under strict sterile conditions. How do I know a person who's fallen while playing has hit his hand against something, has a fracture? It's simple. They'll be unable to move the hand. If there is a deformity like a break and all, the whole alignment would have changed. And what you need to do here, they'll have extreme pain. They'll not be able to move their hands or legs. What you need to do as a first aid is, please don't try to, sometimes preventing yourself to do something is also a first aid. So this is a place where you don't go and attempt to straighten the deformity, because that can injure the blood vessels around. What you need to do is give a painkiller, which is a paracetamol. You have to apply ice over the swelling to decrease it. If it's an open fracture, don't do anything. And you feel somebody has fallen from the balcony or some floor, and you feel the spine would have got injured, please do not try to move them at all. Call for help immediately. That's the only first aid you can do there. So now I have a sprain. I have twisted my ankle, which is one of the common symptoms that college students may come across to. What do I do then? Going on to the next slide, we are going to talk about sprains. I am going to treat a sprain because I don't know medically whether it's a sprain or not. So I will think it's still a fracture, and I'll continue doing the care for fracture, and I'll give rest. I'll put ice. I'll compress the area with a bandage using the crepe bandage. The crepe bandage was part of your first aid kit. The same way I'm going to do that and elevate the limb and call for help. Tweezers, if you remember, we had it in first aid. That can be always used to remove the splinters out there. The next slide is going to talk in case I fall. I have my head hit against someone, which can happen. Very rare situation. Can happen in a college area, school area, or even in working area. What do I do then? What I need to do? What are the indicators? First, I need to know when do I suspect that? When can I say this person has had a head injury on ground? When a person is unable to move, when there's a person who's complaining of a headache after a fall, the person is vomiting continuously, fitting after that, and there is some bluish discoloration around the eyes, there is bleed from the nose, ears, or the throat. These are all places where you will suspect a head injury and you will not immobilize. Call for help immediately, because the best care is always the golden hour care which is given at a hospital setup. Spine injury, this is how we all need to know if you are suspecting a cervical spine injury. How do you remove them? You need to use a log roll for doing that. So if I wish I had my laptop Zoom working, I would have shared. I had log roll video in mind which I was unable to share in the presentation. So here, this is how you're going to treat. Going on to the next slide. I am going to go to drowning. The next slide, can you move? No, dental injury is not much common in adolescence, but it happens. We all know how to deal with that. So if I have a person who's drowning in a swimming pool or something, I need to work off my ABCs, airway, breathing, circulation. You need to see if there's a response. If there's no response, you need to initiate the CPR. It's all part of the basic life support, which is also part of the first aid. But I wouldn't be able to concentrate much on BLS because that's a whole day session for us. I'll just touch upon it. In drowning, what we need to remember is they're in water. When they're taken out, the temperature, the core body temperature drops down, which makes them go to hypothermia. And when hypothermia happens, a lot of changes in the brain that can happen. So rewarming is what is required. So you need to wipe the person off the water, cover them in warm blankets. That's what rewarming as a first aid means. So if I have the next slide, after this slide, please. The next slide. So I have an eye where there's a foreign body that has entered inside. The next slide, yeah, correct, absolutely. So what I need to do is, if I have a foreign body in the eye, I need to go to the eye sprinkling area that's there, eye wash area. I need to flush the eye at least for 5 minutes if it's a water soluble. Otherwise, it goes on for 20 minutes if it is a chemical burn that is caused to the eye. Chemical. 20 to 30 minutes minimum, and do not even touch or use tweezers. Do not use anything to remove this foreign body out. You give a painkiller. If the pain persists, please go immediately to emergency medical services. Irrigation of the eye is what is required. That can be done in the hospital setup, but 5 to 30 minutes. A simple water soluble foreign body, 5 minutes. Chemicals, definitely 20 to 30 minutes, no doubt in that. Then somebody is choking. The next slide. Somebody is choking, and yeah, this is something we teach the students or the teachers in schools, but trust me, even in my hospital setup out here, we've had our adults who, our own employees who would have choked and landed up in emergency. We had to do for adults the choking relieving manuals. So choking is something all of you need to learn. The universal sign of choking is they'll hold their hands in front of their necks, lean forward, want to cough, want to speak, but will be unable to do so. That's what happens in them. And What you need to do in this situation is do a helix maneuver by forming a fist with one arm with the thumb inside. I hope you can see my hand out here when I'm showing you how to form a fist. A thumb inside the hand. Put this in part in between the sternum, lower half of the sternal bone and the umbilicus, and with the other hand you have to hold and give an inward and upward thrust. That you give five, at least, most of the times within 5 minutes. I mean, five abdominal thrusts known as the helix mania, the foreign body comes out. But it may happen that it may continue and you will have to give more thrust, and you keep doing this till the foreign body comes out or they become unresponsive. Once they become unresponsive, you continue giving, going to the arrest algorithm. So the next slide, please. So this is injury prevention strategies that have been shown. It's always a triangle. There has to be an individual, there has to be an environment, and also an agent. The only thing we can monitor is the behavior of the individual and change the environment. I know most of the schools and almost all the schools and colleges are environment friendly. And so we need to train our students. We need to train each other. It's not necessarily the college has to impart. It's also the students who have to train each other, telling what is safe, what is not. Because as I said, adolescents are fearless. We need to have a safety checklist to be performed in your center as an ongoing process continuously. So prevention tips is always good supervision, and always learn and discover what can be improved the next time. So I'm not going to suggest going to the next slide. These are the few suggestions that Apollo Shine has come, that you can use the safety checklist, rotate roles within the staff each week, use injury prevention activities with children. That's the next slide, please. Organize a safety event that includes one of the rules that have to be followed. Injury prevention plan, how it is made is by involving all staff. Whatever incidents have happened till date, review them, use the injury triangle of the individual, the environment, and the agent. Find out what can be done, plan a safety activity, do simulations in that, write down the important dates in the calendar for doing that, schedule for safety activities, and use your resources. We're going to touch a little on medical emergencies where first aid makes a difference. Suppose if a student or any person in your campus or anywhere, even in your home or where you're traveling, becomes unconscious, you need to assess basic life support, talks about a few things. You need to call for help immediately, check for the responsiveness by tapping the shoulders, asking, are you okay? Check for pulse and breathing, not there, start CPR. Initiate CPR. And if the person is breathing normally, you have to make a recovery position. Please understand that most of the times, the EMS call is either 108, which is the national ambulance number, or 1066, which is the Apollo's number that has been given here. The only thing or the only message definitely I want all of you to take from this session is, when a person is not in the best of their mental status, which means they're confused, they're not able to swallow properly, they just had some injury, please don't force food or drinks into them. Don't tell them they can aspirate and choke to death. So please don't do that. And please don't place a pillow underneath, don't slap a person, don't put water. I mean, everybody we threw water over the face and the person became, no, please don't do that. So now there are some breathing difficulties the person is facing. What do? I need to find out if the person is asthmatic. If yes, use the inhaler which is available. If there are improvement or not, see. In a person who's not wheezing, call for help immediately. Ask for allergies because a person can land into anaphylaxis. When a person is anaphylaxis, check for airway breathing circulation. If it is definitely a life-threatening, and every college or school should always have an adrenaline in hand because that's a life-saving medicine. Anaphylaxis, none of us have time to even go to the hospital. Trust me, when we encounter anaphylaxis, we ask the parents to keep EpiPen or adrenaline pens at home so that they can administer right then and there. But anaphylaxis needs to be documented by a medical person later on. So going on to the next slide, some of us may have some sugar issues, and this is also known as having diabetes, which means the body is not able to get rid of the excess sugar that is being produced. Such people may be on oral hypoglycemics or even on insulins. So what do we need to do? There are three perspectives to it. What is the student supposed to do? What is the teacher supposed to do? What is the first aid supposed to do? The student should always carry an ID card saying they are diabetic, what medications they are on, and also how are they monitoring their sugars. There should be an ID, like how we have ID cards, there needs to be a diabetic card. The previous slide, please. We haven't yet finished this. Always, for an institute perspective, we need to know which student has diabetes. It should be recorded and kept so that we can act immediately. Always check for the sugars and give, if the person is awake, able to talk to you normally, then only offer candies and biscuits. Otherwise, no, call for help immediately. Going on to the next slide, heat emergencies. There can be heat cramps, heat exhaustion, heat strokes. All three are different things. Heat cramps are just painful muscle spasms. All you need to do is rest, cool, drink electrolytes. Which natural drink do you think is perfect for such an environment? And Tamil Nadu is quite loaded with it. Which type of drink? Any answers out there? Which drink that is available very easily is quite rich in electrolytes? I hope everybody is there, or am I talking to myself? Yeah, coconut water. Tender coconut water that and solitaire they keep giving. That's an amazing drink. It's actually sort of a healthy. It's actually what you require for heat cramps, or even buttermilk and all those things. Heat exhaustion is where there's exercise-induced heat, loss of sweat so much that your electrolytes have gone down and so much of volume has gone down that you feel giddy and all. All you need to do is lie down in a cool, chill place. Use cool sprays. Encourage drinking electrolytes with carbohydrate mixtures, which will be sort of your ORS, and take them to hospital immediately. Heat strokes, when they get confused along with exhaustion and they start throwing up seizures, that is there. So we need to, this is a real medical emergency. So in the next slide, as I have talked, we know what to do in giddiness. The next slide, please. Fainting and dizziness. We know we have to make a student lie down with the feet elevated up, and please let them rest till they have fully recovered of the symptoms, and send them home, inform their guardians. Fever and not well, they can be given as a first aid. They can be given a paracetamol, post which they are supposed to see their doctor if it keeps persisting, all the more in pandemic to rule out even COVID. Going on to the next slide, what do I do? Frictions causing blisters. I need to use gloves, and these are blisters which you should not break. They are sterile blisters, they will disappear by themselves. If they have already broken, all you need to clean is soap and water and apply antiseptic solution if required. Skin rashes, I'm allergic, I can have. So what I need to do is Notify your parents and seek medical attention because rashes can happen because of multiple things. Could be even a simple dengue and can go to some dermatological conditions which can be varied. I have an ear pain, or I feel there's a foreign body inside. A bee has entered, or small insect has entered, ant has entered. Please don't try to pour water, which people try to do, and do it. Try to tilt the head to the affected side. Let the gravity play. What we find interesting is put a torch, a highlight. Most of the times the insects do come out. If you see an insect inside, please don't try to put finger and pour water. Don't pour water, don't pour oil and all. Please don't do all that. You need to notify and come to your school immediately. Come to the hospital immediately. I have this person who is having a constant one-time headache, give a paracetamol, ask them to see for symptoms. But if I have this person who keeps coming to my sick room with headache all the time, what do I do? What I need to do is see if any other features on their fever. If the person is drowsy, looks as if he wants to sleep all the time, not seeing properly, even a normal vision, refractory errors, they're not able to see properly the blackboard or something written, that can also cause a headache. So they need to seek attention in this case. Next, the stomachache is something which is quite common. So I need to see if this person is having a stomachache along with vomiting, what is the duration of it. If there are loose stools associated, I need to give ORS and I need to look for signs of dehydration and go to the medical service soon. Poisonings, bites and stings, go to the next center. So here we have shared the college poison information center for instructions. You could even call the Apollo emergency for the same. You need to send the person immediately. Don't try to make them vomit and all because that itself can cause aspiration. Don't encourage that. If there's a bite, it's simple. Insect bite, wash under soap and water. For finer, it's simple. Soap is an alkali. What has bit is an acid, this sort of neutralization out there which is going to happen, and cover it until it's not bleeding. If it's bleeding, attention is to be. If there is any bite from dogs, cats, horses, bats, there's definitely a need for anti-rabies vaccine that is required and has to be followed immediately. Bee sting, apply for 5 minutes, 15 minutes. Ice as a first aid. Monitor for an hour. They say apply baking soda, but what also helps, I have noticed as a child when I used to have it is you have this washing soaps, the clothes washing soaps. I don't want to take the brands, but clothes washing, you rub over your area. It sort of is like NaHCO3, so it really helps. And check for any history allergy. If it is beyond a point, please seek for help. There are snakes around in your campus. What you need to do is snake bite, do it right. What you need to do is reassure yourself that most 70% of these are non-poisonous. Immobilize how you would have seen in a fracture by just splinting. Get to the hospital as soon as possible and tell the doctor because there's nothing beyond that. That can be done. Do not tie tourniquets in case of snake bite. A person is seizing, throwing fits. What do I do? Next slide. When I throw fits, my tongue will go back and it laps from the airway. So I need to do the left lateral position where I'm going to do that. Protect them from self-injury. Will not insert anything in their mouth and notify the parents for medical care or the EMS. If the institute has diazepam suppository, you can apply it. Or midazolam sprays, whatever is available. Next slide, please. So this is about abuse which can happen in every place. I'm not going to touch upon it much, but next slide. What we need to think is this really abuse? If yes, because of some unusual injuries or suspicious things that are happening, there will be some warning signs. We all need to be trained. We're all adults. We need to recognize abuse, fight it. The steps to take is always report the abuse, become familiar what is happening. Go to the next slide, please. So these are the various emergency numbers that you need to reach, and including 108 also, which is a national ambulance number. Apollo Children's emergency number is there, the general emergency number, and also the Apollo ambulance. Call if any time the person is unconscious, semi-conscious, confused, airway is blocked, there is a trauma, the child is not breathing, having difficulty to do so, choking, the person has no pulse, there's a bleeding that in spite of your maximum effort, you're not able to stop, they're coughing, throwing up blood, the person is has taken something which has acted as a poison, they have been seizing, or some injuries which are unexplainable and severe pain. You'll also tell if there is any severe, you'll also report if there are any severe eye injuries, any amputations that have happened, or anything that has worried you to make them go to the EMS. So how do you hand over? Next slide, please. Sometimes there is a time that happens for traveling from your college to the nearest medical. So in between, there can be a lot of things that can be done when you communicate to the emergency medical service system what is to be done. What you need to do is introduce yourself, tell what happened, answer any questions, follow the instructions. Please don't hang up. There may be pre-arrival instructions that will help during the transport, and give the full address of the school, nearest landmarks, directions, phone number of the college, and exact possible place where to come inside, because it's quite a widespread, and always stay calm. Have an incident form, which could, one of the type of formats is this, where you know whom to call, and always complete it as soon as possible, very specific, very objective, write clearly, and try to fill in as soon as possible. Going on to the next slide, an ounce of prevention is better than a pound of care, and cure, definitely, yes, no doubt about this. So take more cautions, precautions, multiple things to prevent rather than always curing. So make sure you're the best, because you and only you can be the best for yourself. With that, I'm going to come to the end of this slide, saying thank you. The next slide, please. Just before I'm about to close and the presentation, I'm going to thank Ms. Mahalakshmi of the college, who has been constantly in touch and has put up with all my technical adversities, along with Ms. Kavita from the Shine Department, Dr. Indra Kumar, for giving me this amazing opportunity to be into this. Last but not the least, I need to thank my own management and administration for allowing me to speak out during my busy pediatric emergency practice. So thank you very much. Had a great time with all of you. Sneha, thank you so much for operating the slides. You did an amazing job out there. With that, I'm going to open up for all the questions from all of you.
Yes, ma'am. Thank you.
Thank you, ma'am. Thank you so much for the articulate and informative speech, ma'am. Thank you for spending a valuable time with us. We got enlightened about how to do the first aid of the emergency. Gratitude makes sense of past, brings peace for today, and creates a vision for tomorrow. Now, I call upon Mrs. Mahalakshmi, Health Coordinator, Assistant Professor, Department of Nutrition, Food Service Management and Diabetes, to propose vote of thanks.
Very good morning to all. It's a great honor and privilege to propose the vote of thanks on this memorable occasion. First, let us start by giving glory to the Almighty God for making this week's session a great success. All our dreams can come true if you have the courage to pursue them. Walt Disney. I extend my thanks to Principal Ma'am, Dr. R. Geeta, Vice Principal, Dr. Lekha Ma'am, Aided Stream, Dr. Sita Lakshmi Ma'am, and Dr. Magishashura Mardini Ma'am, Self-Support Stream, for being with us throughout in supporting and encouraging us in completing this session. I extend my gratitude in thanking Mrs. Kavita Iyer from Apollo Shine Foundation, who has been a right hand for us in contacting the esteemed doctors for completing this wonderful and informative series of webinars. I extend my heartfelt thanks to the union members for for helping us make this series of webinar a notable one. I would like to thank Marishwari sister for helping us. My special thanks to ESRM team who have worked behind the scenes in providing technical support for the smooth live stream of this series. I am honored in taking the liberty of thanking the stars of the series, the heroes behind the mask, the doctors who have spent time from the busy schedule in providing us with evidence-based knowledge on various topics. I thank Dr. Indra Jaikumar ma'am, Dr. Saubarnika Ramamurthy ma'am, Dr. Daphne ma'am, Dr. Kirtibai ma'am, and guest speaker of today, Dr. Anita Tarikopulla ma'am, for making this series a splendid success. Great things are done by a series of small things brought together. Nothing is done in a way. We have been fortunate enough to be blessed with supportive and hardworking staff and students who have put in a lot of effort in making this series a grand success. Thank you so much, ma'am.
Thank you, ma'am. Ends are not bad things. They just mean that something else is good to begin. Some things are never ending. By Joe Bell. Thank you, everyone. This is Health Team signing off. Stay safe, take care, and be happy. Thank you.
Namaste.
Thank you, ma'am.
Thank you.